Hello, I am Dr. Venkataram Mysore, Dermatologist, hair transplant surgeon, Venkat Center for Aesthetic Health, Vanashankari, Vijayanagar, Cunningham Road, Bengaluru. Keloids. Many people are not aware of it, but those who have them dread them. These are lumps which develop on scars. Patient gets an injury, patient gets a burn, patient has a surgery, and then those scars become thick, keep growing in an ungainly, ugly way, keep spreading, cause pain, and then affect the patient badly. Sometimes they are 1, sometimes they are 10, 15, 20. Doesn't happen in everybody, happens only in those who are predisposed to it. And so what are these keloids? You can see here. Keloids are scars which become hypertrophic and continue to grow. They become thick, tender, red and painful. They grow for 6 months, 1 year, 2 years, they keep on growing. Most common site is the chest, as you can see here, shoulders, back, sometimes in the beard region, sometimes elsewhere in the body. Generally, they are common on the bony areas, and that is why sternum is one of the commonest area. They often start here, go to the other side, make it difficult for the chest to expand, difficult while breathing. And the treatment is not that easy. It has to be properly planned and it has to be systematic. Keloids happen only in some people, as I told. These people have to be extremely careful about injury, any kind of injury, any kind of infection. So, now how do we manage the steroids? I am doing this video today because 11th July is World Scar Free Day. July month is scar free month, and keloids are a type of scar. Keloids happen because as part of a healing process after an injury, collagen is produced. But the collagen production has to stop at a particular point. But sometimes it doesn't stop. It keeps on growing. That is when a keloid happens. It stretches the skin, becomes red in the beginning, black later. Now, how do we treat keloid? People ask, can you please remove it? Simple answer. Removal is associated with a very high percentage of relapse. 80%, 90% chances of relapse. So we generally don't like to remove it except when it is on the earlobe. Earlobe keloids can be removed, but after removing it we give injection there. Sometimes we remove it followed by X-ray for extensive keloids. Otherwise surgery is not a good option. So then how do we treat? The first line treatment is injection. Injection of a steroid, injection of a drug called 5-fluorouracil. Sometimes a combination of both is injected into the keloid, and that is enough for all small keloids, limited number of keloids. Then we can also use laser, Nd:YAG laser. You can see here the machine. We use it to control the blood vessels and normalize the collagen. So that is one type of treatment. 3 to 4 sessions are needed. Works very well in early keloids. Pulse dye laser can also be used for early keloids. This affects the blood vessels. You can destroy the keloid by carbon dioxide laser or a machine called radio frequency. We also use a method called intralesional radio frequency, that is to burn the keloid within the skin without removing the outer skin. And sometimes we use combinations of all this. And then we can also use other types of machines to prevent the cause of laser. For example, if you have got a hairy chest and the keloid is expanding, the keloid engulfs that hair and the hair inside the keloid promotes more keloid. So we destroy hair by Nd:YAG laser. That way we prevent keloid in future. You can see the results of these keloids in some of these cases that I am showing here. And then if we are doing surgery, like I mentioned this earlobe keloid, we have to inject a steroid in its place to prevent injection. Compression bandage is one type of treatment for keloid. Cryosurgery, very cold gas with liquid nitrogen, is another type of treatment for keloid. Grafting is generally not done for a keloid. There are various other types of treatment such as botulinum toxin injection, insulin injection, bleomycin injection. All these are available for the treatment of keloids. There are no oral drugs for keloid, that I want to make it very clear. So generally hygiene, compression, topical applications of steroid creams, injection of steroids, 5-fluorouracil, lasers, radio frequency, cryosurgery and finally surgery. These are the different methods of opening keloids. Now, people ask, can we have any creams for keloid? Creams are there. There are different types of creams to decrease scar production, but they generally don't work that well. Keloid is not that easy to treat. Remember, keloid has to be differentiated from what is called a hypertrophic scar, in which the scar is only thicker. That subsides easily. Most keloids can be treated easily as long as they are small in size and few in number. But sometimes people come with very large keloids, like in this patient, after burns patient. They are difficult to manage it, and there one of the modalities is surgery under general anesthesia, and within 2 days or 3 days putting X-ray on it. This is a drastic thing, not usually done because these X-ray machines are available only in large hospitals. But that is a method when the keloids are very, very large. So keloids are extremely important, but patient has to be motivated for proper treatment, take preventive actions as well as treatment options. There has to be a plan for removing it. It is not easy and casual treatments cannot work on it. Persistent, sustained effort is what is needed. At Venkat Center, we have all the modalities for keloid treatment, from the different types of injections, radio frequency, Nd:YAG laser, carbon dioxide laser, IPL, cryosurgery, and of course we have 2 plastic surgeons to do the surgery. So with all this, we can handle most keloids properly. Please contact us for any help. We are there to support you. I hope you have liked this video. Thank you very much.